All right, what a fantastic question, especially when you're investing lots of money in dental implants. How long do they last? And the assumption here is maybe 10 years. And so I want to go through that real quick. So there's a lot of factors when it comes to implant success and longevity. So it's going to be, and I'm sure you're not just talking just the implants, you're probably talking the smile that gets screwed in on them. So both are going to be part of how long your smile lasts, right? So first, let's talk about the dental implants. As long as they're in the bone with good blood supply and good connective tissue on the all the way around, right? Front side, or we call it the facial, and lingual, or tongue side, then we're going to get good long-term success. And what does that mean? Probably decades, if not a lifetime. Okay, so dental implants are a phenomenal investment when they're placed correctly in the middle of the bone for good gum health. Okay, so that's important. Then it becomes a matter of how well is the system designed and what material are we placing on those implants. So that's going to be determining how long your smile would last without fracture or damage. Okay, so the material obviously is a big factor, but I'd say even more importantly than the material, it is the design. So how well are implants spaced? How well do they support the material that is on, so your smile that's screwed into those implants? Are the implants right down the middle of the teeth because it was master planned and designed correctly? All of those are going to play a factor. Also, is there any distal extensions or anything unsupported, right, that extends beyond the smile? Was there enough thickness for the material, right? Was there proper reduction of the bone to make a good enough thickness for your new set of teeth screwed in on those implants? So I know that's a lot, but all those factors matter. So design, implant location, material, support, right? And then obviously not abusing it. Wearing your night guard's another great solution too. So I expect that most patients with good gum health, proper implant placement, proper structural design should get many, many decades. I think most dentists that do this procedure should be at least warranting these teeth for 5-10 years, somewhere in that range. And the reason being is if you get past a 5-year life on an implant smile screwed, teeth screwed in on implants, then you should expect many more than that, as long as there wasn't any major wear or tear during those 5 years. It means that all the structural issues like support, implant location, proper dimensions of your new smile and strength for longevity, right? All were done correctly by your surgeon and your prosthodontist, or maybe they're the same person. So I hopefully that answers your question. I know it's a big one, it's a long one, and I gave you a long answer, but I'd expect many, many, many decades on implants if they're done correctly. What's going to make them not last very long? If they weren't down the middle of the bone, right? You have bad gum health, you have poor connective tissue, maybe the design was the teeth are too thin, there wasn't proper support to give the smile enough implants underneath all of the arch. Material wasn't thick enough, right, for that particular material. Maybe the technician didn't design it correctly. So usually those failures are going to happen fairly quickly. So just to give you an idea, if you get a few years on a smile, you're probably going to get much, much longer than that. Because a few years means that there wasn't any structural issue, and likely as long as you're maintaining your gum health, seeing your dentist regularly for cleanings, maintaining it at home, wearing your night guard at night, you should do really well. So long-winded answer, but I wanted to answer as many questions as I possibly could about longevity, because when you're spending tens of thousands of dollars on a new smile, you probably want to know what you're going to get out of it. It will vary based on the quality of the work, for sure. This is why you want to keep doing the research. This is why it's a good question. I'm glad you asked it. Do the research, make sure you find someone who is skilled, capable, understands all of these variables, and can give you an amazingly balanced new smile on implants, done correctly and balanced for you, right? Huge deal. So best of luck. Have a good one. Sorry for the long answer. Hopefully it helps. Bye.